Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is February 3. Addressing systemic poverty has been a social and political issue for some time, but the need continues to grow, even more so under the COVID-19 pandemic. Wausau Mayor Katie Rosenberg is looking to address this in a new way by joining a pilot program that will guarantee a basic income for struggling families. She joins us now from Wausau to tell us more about it. And Katie, thank you so much for joining us. I wanted to start just by asking you, how did Wausau get into this pilot program? Where did the idea start from? And then where are you at in the process?
Sure. So, as all good things start and weird things, I was looking on Twitter, reading the news, and I saw that Madison had been considering joining this program. And so I liked the tweet and I moved on because there's no way Wausau could get into this. But the person who organizes this program reached out to me and they said, "Hey, are you interested?" So we talked, and I learned a little bit more about the program. And obviously, with all things government and all things in the world, you wonder, where does this funding come from? And there are a lot of different organizations that use CARE funding or private donations. But Mayors for a Guaranteed Income is offering grants of up to $500,000 for cities who enter this pilot program. So we're in the process of applying for that initial entry into the program. Our finance committee unanimously supported it, and now it's moving on to our city council next week, Tuesday.
All right. And so for those who don't know, let's back up one step. And what is guaranteed income? What does that mean?
Sure. So you probably heard a little bit about the universal basic income concept with Andrew Yang when he was running for president. I'm sure we'll hear a lot about it in his mayoral campaign in New York City. This is a little bit different. Guaranteed income is more about kind of leveling out the playing field. It's very targeted at the folks who need it the most. And so what we're seeing in the pilot programs is anywhere from maybe 18 families to maybe 150 who apply to be a part of this, and they'll get $500 a month for between a year and a half. And we're partnering, these cities are partnering with the University of Pennsylvania, and they are really rigorously tracking the data, asking these people questions. How is it improving your life? So that's kind of what it looks like, the pilot program. But yeah, $500 a month just to kind of level it out.
And how do you determine which families are going to be participating in the pilot program?
Yeah, so this is something that individual cities have kind of lined up to decide their criteria for entrance. So, we in Wausau have different criteria for various programming, whether it's housing assistance, rental assistance, down payment, things like that. So we're pretty good at deciding and helping figure out who has the biggest need for various programs. But this is a little bit different. We're talking about people who probably are already working. Maybe they're working 3 jobs. Maybe they are looking to spend a little bit more time with their families. So when I'm assuming when we enter this program, we will work with some of our local agencies and determine what are the criteria that should be met. Should folks have a job? Should it be targeted more towards families? Should it be targeted at whatever criteria it is? In Pittsburgh, for instance, they noticed that Black women had the worst outcomes from poverty. So they really put a lot of effort into building that community up.
And $500, why that amount specifically?
I think, it's a lot of money if you don't have it, but it's also not a lot to live on. Some of the criticism I've already been seeing from people who maybe don't know a lot about the program yet is that, people should be working. We shouldn't just give handouts, things like that. And so this is really an opportunity to supplement an income or supplement what people are already bringing in from other sources rather than replacing it. So that's basically where that number came from. It's also kind of the best practice from the organization and the researchers, so I definitely want to follow the science here too.
And I did want to talk about some of that criticism. I mean, Wisconsin in particular, under former Governor Scott Walker, passed additional reforms for welfare and basically required additional work requirements to get welfare benefits such as food share. So do you think that this is feasible in a political climate like Wisconsin?
I understand there are philosophical differences, especially when we're approaching public policy in this way. And this is really what's awesome about the pilot program is that, we're not locking ourselves into a program that will go on through eternity, right? It's science, it's a research project, it's 18 months and then we're out. So it's building up to a bigger policy discussion, likely at the federal level, but it's building in that data. So I would say to people who are maybe unsure, like, let's just give it a shot. Let's add to the body of science. Let's see where this takes us. Let's see what the results are. I understand the philosophical differences, but this could really change the way even welfare works. One of the arguments is that this could be a program that replaces something like welfare. So, we don't know where we're going here, but this will build into those better policy discussions.
And one more area of criticism, I mean, things like food share already dictate what people can buy with those dollars, but as I understand it, this $500 a month is no strings attached. And so are you skeptical about people being judged for what they end up purchasing with that money, or will that not be tracked at all?
It will be tracked. So in other cities, they've used debit cards, so you can actually see what people are buying. Initially, what they found was people were so shocked that they were given this money that they just pulled it out as cash and spent it that way. But there are researchers that follow up with that. So I think there is an opportunity to go into this with healthy skepticism. Obviously, we don't want the money going towards lottery tickets and alcohol if you are trying to support a family, but that's not a requirement of this. I think that what we'll find out, and this is what the research is already showing, that 75% of these dollars go to things like clothing and food. So I am pretty sure this is what we're going to see when I'm talking to people in my community that are in the greatest need. They're looking for those basics. So I want to go into this with positive, assuming positive intent.
And when you talk about your community, as you said, Madison is working to implement this already. Milwaukee is considering it. Why Wausau? Wausau is around 40,000 people in the middle of the state. Why your city?
Why not? I think that we have a lot to offer as far as different demographics. I think that, again, like adding to that body of science and going to cities that maybe aren't as big as the Stockton, Californias, or even the Madison, Wisconsins. I think it will help us understand what the need looks like. And I think it will just build a better case for that public policy moving forward.
And so you talked about the social science researchers. So the University of Pennsylvania is part of this pilot program. And so they are not only studying what happens in Wausau, which I believe is the smallest city that's a part of the study, but in cities all across the country. And so what are they looking for exactly? You touched on this a little bit earlier, but what areas are they looking to understand better?
Yeah, so this is the part where, you're going into it. You want to know, what are the needs people are experiencing? What are they actually spending that money on? Where are the gaps? What are the problems that they're seeing? What are the barriers? And so I think part of this is just to explore what can be done, and the quality of life indicators. Are you able to stop going to one of those title companies, title loans? Those things are very harmful because of the interest rates. So seeing how people are changing their behaviors based on a pretty small amount of money in the big scheme of things. How are they able to even get above those barriers? How are they able to have better lives for their families? Are they able to spend more time with their kids? Instead of working 3 jobs, they can work on homework with their kids. So that's kind of, those social things too are very important. It's not just about, meeting those basic needs. It's about, what does it mean to be human in America?
And at the end of 18 months, which you said that's the length of this program, what do you hope to happen after that? Is there a long-term plan, or are you just looking to get it going now?
Yeah, I think it's more about getting it going, collecting the data, and I will be paying very close attention to what kind of results we're seeing. If this is really good for our community, of course, we're going to have to think about a way to respond to that need once it's not there anymore. But I'm going into this with that kind of experimental mindset and cheering for science along the way.
As we are entering about a year, Friday will be the 1 year anniversary of the first coronavirus case in Wisconsin. How has Wausau been faring in this pandemic? Do you see the need for a program like this even stronger?
Yeah, we're seeing that there's definitely a need. We're lucky that we've had some protections. There's been eviction moratoriums. We have a really great local regional food pantry, but they're seeing an increased need more than ever before. I mean, we handed out, I want to say, 100 boxes of food to families in about 2 hours. So we're seeing that increased need, and it's not the people that you would expect. It's everybody that needs a helping hand right now. It's really been tough. And especially on people who maybe own their own businesses, or maybe they're hairstylists who couldn't be open. So we're seeing it across the board from all kinds of different demographics and people. So it's tough. I know that we have a fighting spirit and we'll get through this. And I'm hoping that this is the kind of program that will help kind of supercharge that recovery into the future.
Do you hope that it could potentially be expanded to a universal basic income program?
I'm interested in seeing what the data shows. There's a lot of differing kind of analysis on the programs. And part of that is just we don't know. We don't know what's going to happen. We don't know how people are going to react. So I'm interested in what we can learn and glean from the science. And obviously, public policy is one of those things that is changing all the time. When you have changes in governors, when you have changes in presidents. So I'm interested in seeing how this can help direct their secretaries and the Congress. So that's what I'm going into. Again, I really hope this works out great and it leads us to some great conclusions.
And you said this goes to your city council next Tuesday. What do you understand about whether it's supported or not? What have the questions of skepticism or concern been from either the city council or the community?
Yeah, so the Finance Committee unanimously approved this program, so I feel pretty confident that the City Council will follow suit. I obviously don't know for sure, but the criticisms that I've been seeing are from folks who think that, again, that question of people should be working, they shouldn't just get a free something. And, my answer is they will be working. $500 is definitely not enough to pay rent, get food, support your family and some other questions came about with, well, what about taxpayer dollars? And so right now, understanding that this is coming from a grant has kind of assuaged some of those concerns where it comes from that money. A lot of questions, well, what if it does work? Are you going to use money then? So I guess we kind of have to decide then what we'll do. The city of Stockton had this program going for, I think, 18 months. And then they decided that since it was ending right in the middle of the pandemic, that they would expand it a little bit longer. We might see things that we really like. Maybe we'll pull pieces from it. But, I think, again, the criticisms are those that can be solved right now. But worrying about the future doesn't really get us where we need to go right now. So I'm going to rely on that body of science and how this adds to public policy.
And if this is passed by the City Council next week, how soon can you see it implemented, as we don't know at this point when the pandemic will end?
Yeah, it is go time after that. So the first thing we have to do as a city is come up with those criteria. So I will be pulling in folks from our nonprofit organizations who work with these populations. We'll develop criteria. We'll want to connect. One of the things we didn't talk about was a local researcher. There's a fellowship that the Mayors for a Guaranteed Income also offers. So we'll need to identify that fellow to kind of help us make sure that we're tracking the right people. And then we'll need to come up with a plan. What does this actually look like here? And then and we'll talk to mayors for a guaranteed income. How does this look? What are you thinking? There was a city, I think in North Carolina, that came up with a plan to address 18 people. And mayors for a guaranteed income loved it so much. They were like, we want you to expand this to 55 people. Here's $500,000. So, we'll get there. We want to make sure that what we're crafting is scalable, but also makes sense for our city.
All right, Wausau Mayor Katie Rosenberg, thank you very much for joining us today.
Thank you so much. This was fun.
For more from Here and Now and PBS Wisconsin, you can visit pbswisconsin.org, and thank you so much for joining us on Noon Wednesday.